Spring is officially here, and so that means it's time for the pollen. But is the weather too cold for the spring allergies?
Dr. Bob is here, and he knows the answer. So it's kind of chilly. Does that mean I've got no problem with my allergies today?
And that's a great question. But as sure as spring is here, pollen is going to be here. So the pollen, the tree pollen, that's already been high. What is pollen? Pollen are little grains that come from the flowers. They're like little dust. Later on, you'll be able to write your name on the car. That's the pollen that's there. But these little pollen grains are so small that they float around in the air everywhere. We breathe them in our nose, and that's where the allergic reaction occurs. That will cause symptoms of hay fever and asthma. So it causes stuffy nose, runny nose, sneezing, itchy nose, congestion, can't sleep, can't taste food, feel miserable. Almost the same symptoms as a common cold, but people know because they had allergies last year. They know that it's coming around, and they know that they've got problems. The treatment can be very, very good. The treatment is several things. Number one is avoidance. Well, the pollen flies around everywhere, and you're not going to be able to avoid it no matter what.
Stay inside, right?
Stay inside. But it's springtime. We want to get outside. We want to have fun. So next would be the antihistamines. They work. They're very, very effective. But be careful because antihistamines can make you sleepy. For instance, Zyrtec, cetirizine, 14% of people get sleepy. Benadryl, sometimes we find that in sleeping medicines, but the advertisements will be there saying it's a very effective antihistamine, and it does do a good job, but be careful of those side effects. Decongestants, they work great on the congestion of the allergic reaction, but be careful of the side effects of decongestants because they can elevate the blood pressure, they can make it where you can't sleep well, they can make it where you get hyper, they can interfere with your ability to function. So be careful of the side effects of decongestants. Intranasal steroids. So we've got cortisone sprays like Flonase that we could spray into the nose. Very effective. They do a good job. But you have to know how to use them because they can cause nosebleeds. So you need to be sure you spray toward the outside, toward the top of the ear. And when you spray, just make a little sniff. Don't sniff it out of your nose because then it won't be effective. So it's a very, very effective medicine. And if your medicines don't work, then it's time to talk to the doctor and see. Most people know the good medicines over the counter, but when they get those medicines, they don't know how to use them. So be careful of the side effects. Know that your doctor will help you decide how to use your medicines and to see if you need to have a desensitizing program. It's the only way to really get rid of the allergies is that. So the allergy shots long term, but there's medicines if you know how to take them. And watch out, spring pollen is here.
And you want to enjoy the beautiful weather, so you need to get outdoors, but take those smart steps. Thank you, Dr. Bob. We appreciate it.
Emily, it's always nice to be here. Brandon, it's
always good to see you, Dr. Bob. And you can watch the Dr. Bob Show Tuesdays at 9 p.m. and Sundays at 2:30 p.m. on 10 News 2. All right, still plenty to get to here on the show. On Live at 5 at 4. We're talking